Hello, I'm Dr. Tina Ray. I'm an educational and child psychologist. And today I'm going to present to you the fourth session of my Teens and Tweens Quick Focus. This series of 20 sessions is intended for children and young people to promote and foster their mental health and well-being, particularly in the context that we currently find ourselves in of this COVID pandemic. And today's session 4 is a quick focus on anxiety and worry, the causes, and also some self-help tools. So some basic key strategies to help us manage that anxiety and worry that we may be experiencing right now. So at the start, I need to just flag up for you that anxiety is really quite a normal reaction that we as human beings have when we feel threatened. And this can include physical, emotional, and mental responses, such as an increase in adrenaline. We can feel an increase in worries, confusion, and thinking or thoughts about imminent danger or catastrophic, really bad outcomes. And for many of us at this current time, there appears to be a great deal more of this anxiety around, both for us and for others in the community. Now, we know that, like stress, normal levels of anxiety can help us to really be more focused and motivated. We can solve problems more efficiently, but I'm talking about a normal level. What happens when those levels of anxiety tip over and become really chronic or heightened? This means that we experience these constant feelings of feeling sick, nausea, panic, and we really try to avoid the things that cause that anxiety. So this might be going into school, going outside, meeting friends. There are lots of things that might increase our levels of anxiety to this extent. And I think it's really, really important that what we tend to do is we will then avoid that situation. So there is a risk for us in terms of being able to manage this effectively. The problem with our worries and the way in which we all engage in them on a daily basis is that they can make us feel anxious. So there's little worries that if we don't talk about them, we don't share them, we don't problem solve with others who care for us, then they can tip over into heightened levels of anxieties. But anxiety is actually quite easy to pick out and to notice if you really know what you're looking for, okay? Some people, however, do suffer from anxieties and don't really quite get it. They don't realize what's happening. And when you're anxious, it's really important to begin to notice what the actual symptoms are. So it can be any one or all of these, but it doesn't necessarily have to be all of them. You might feel your heart rate speeding up. You might have sweaty skin, or you might feel very pale or very red in the face constantly. You might feel continually upset, irritable, on edge, snap at other people, feel angry with them. And sometimes anxiety appears to be just like anger. And that's why people find it so difficult to cope with. And sometimes teachers and adults who don't understand that might think that you're being angry, whereas actually you're not being angry. You're actually having a symptom of anxiety and significant worry. Sometimes you might feel that something terrible is about to happen. You have this kind of premonition. Your throat or mouth can be very, very dry. You can experience muscle aches or really bad headaches, or you can feel very fatigued, very tired, and lacking in energy. You can't just have the kind of find the energy to do the things that you would normally do. And for some of us, this also translates or transfers into symptoms like stomach aches or bowel problems. Our digestion is affected, and we can have that horrible tummy ache that's gnawing at us continually. And anxiety can also stop us from concentrating. So it makes work much harder. And if you're finding it really difficult to concentrate and focus on your work, revise things, memorize things, organize yourself, it may be that you have a certain level of anxiety that is a bit too much for you to actually manage at the moment. Really, really important. The more anxious you get, the more you worry, and then the more anxious you become. And it becomes a vicious cycle. So we need to be able to break this. And there are some very, very simple things that we can do as soon as we feel this heightened level of anxiety beginning to emerge. And we need to actually factor these into our daily routines, in my view. Tip 1 is to notice. Notice when you're feeling anxious or you're worrying that wee bit too much, it's the first step in really trying to make things better and improve your daily life experience. So if you feel any of the symptoms that I mentioned in that last slide, or you notice that you're thinking negative thoughts for most of the time, then really take note of these. I think a journal is a really good way of doing this, because you can jot these down and you can reflect on them, and you can pick out the patterns, and you can pick out the symptoms, and then you've got something to go on if you want to then go and share this information with a trusted adult or someone who can help you either at home or in school. Tip 2 is to just simply stop. When you're noticing that you're worrying all the time, then just say to yourself, right, stop, and see if you can get your brain into doing something else. It's a distraction mechanism. So try thinking of something else, especially something relaxing or enjoyable, or doing something else to keep your brain occupied, like reading a novel that you love, reading a book that you really enjoy, watching a movie or a program that makes you laugh or just takes your mind away from the worry, doing a hobby or an activity or a creative activity, playing a sport, whatever it is. Stop and engage in something else. 3, I call this worry time. Some people think this is a bit odd, but I actually think this can really help us. Think about your day and find a time in it when it would be okay to worry. So give yourself a little bit of worry time. No more than about 5 or 10 minutes is necessary. That's your special worry time. So when you find yourself worrying at a time when you've got other things to do, like bedtime, or while you're trying to concentrate on your work or something else, tell yourself to stop and put over those worries for later during that worry time. And sometimes as part of that worry time, jot those worries down, write them down, and then put them to one side. And then go back to them later and talk through them again with a trusted adult or a friend, so that you're kind of just shelving them for that moment in time, and then you're going back to sort them. But that means that you actually schedule this worry time in, so you're not spending all your time worrying. Remember, it's okay not to be okay for a little bit of time, but it's not okay not to be okay for all of the time. Tip 4 is self-talk. So if you find yourself worrying about the same thing over and over again, so I'll start my new school, no one's going to like me, I won't be liked by anybody, then write down for yourself the opposite positive or more accurate thought. For example, people will like me, I'm going to make friends because I'm a nice person, intrinsically I'm a good person and I've had friends before. Then every time you notice yourself worrying and engaging in that first negative thought, the ineffective thought, tell yourself the more positive, effective one. In your head, repeat it again and again. Even carry a small card around with you, write it down, put it in your pocket and bring it out when you need to remind yourself. Tip 5, I call this get away. Get away sometimes from those things that are worrying or upsetting you, even if it's just for a minute. Taking that time away somewhere quiet, just look out of the window for a bit, just do something just for 1 or 2 minutes that allows you mentally or physically, emotionally to get away from the situation. You need sometimes to have a wee bit of instant relief from that worry. And ultimately, I think what is really vital is that you remember to seek help if you feel that your anxiety is becoming a problem, if it's taking over your life, if it's stopping you doing the normal things that you would regularly do on a daily basis, going to school, getting your work done, being nice to other people, doing things that are good for yourself, that make you feel happy. If it's stopping you doing this, then you really must go and seek some help and support, usually from your GP, your doctor, who'll be able to give you some advice with this, and you'll be able to get some additional support. And also, I'd suggest, if you are in school, actually making sure that you go to talk to your mental health lead, your SENCO, your inclusion manager, and really talk about what's been happening and provide them with some of the evidence that you might have collected through your journaling. So ultimately, it's about remembering this, that it's okay not to be okay. All of us have these days. I say they're quite bad days, or a wee bit down, we're over anxious. But it's not okay to feel like that for all of the time. So if you need to, go and get some help. So I hope that this has been useful. Once again, this session 4 in this series for teens and tweens. Ultimately, I want to empower you to be able to create your own toolbox of well-being. So again, reflect on this, think about what you're using now in order to manage your anxieties and your worries, what works for you, what doesn't work so well, what could you do more of? And maybe think about these top tips from today and which one of those may be helpful to you at this point in time. So thank you once again for listening. I hope you'll join me next time and that you found this helpful.